Hello, welcome to ALH3, Chapter 12, Musculoskeletal Medications lecture. The objectives for this lecture are to define all key terms, identify the key features of the musculoskeletal system, discuss the importance of healthy endocrine and nervous system to proper musculoskeletal functioning, recall at least 5 muscular system disorders and 1 appropriate treatment for each. Discuss at least 4 bone or joint disorders and 1 appropriate treatment for each. So you've all taken anatomy and physiology, so we'll just do a brief here, but the musculoskeletal system consists of muscles, tendons, and ligaments, and these tendons and ligaments attach the muscle to the bones, and then we have bones, and there are 206 bones. The nervous system controls the movement of the musculoskeletal system, and bones give structure and they store minerals like calcium, magnesium, and potassium. The endocrine system controls the deposit of these minerals that are stored. So the thyroid produces calcitonin, and this allows calcium to remain in the bone. And the parathyroid gland produces parathyroid hormone, which increases calcium in the blood. Let's look at some muscular disorders. So ailments that originate in the brain, some of those examples would be cerebral palsy, stroke, or multiple sclerosis. Ailments that originate in the muscular tissue itself would be muscle injuries or muscular dystrophy. Muscle spasms and dystonia, which is abnormal tension, are common with all of these disorders and are treated with muscle relaxants and antispasmodic medications. And we see that information here. So the muscular symptoms are the muscle spasms, dystonia, which I said was abnormal tension. For treatments, muscle relaxants and antispasmodics are used. Both medications work to inhibit neurological activity that causes muscle spasms or rigidity. Benzodiazepine, like Valium, may be given to maximize effectiveness of the above medications, although this is being way more regulated recently, and so it's not as done as it used to typically be done for fear of patients getting an addiction to that. Antispasmodics that work on muscle itself, so an example, botulinum toxin type A, which is known as Botox. The toxic substance that causes food poisoning, they lower the dose and then it acts by paralyzing that muscle. So did you know this? That not only is Botox used to reduce the look of wrinkles, but it's also used in treatments as the antispasmodic medication in muscular disorders. It's used to treat chronic migraines, limb spasticity, abnormal head position, and neck pain. So I'm going to switch it up again this week with our comprehension checkpoint. What I'd like you to do now is to get a piece of paper and put your full name on it and number it from, let me see what I need you to number it from 1 to 4 again. And then you are going to see these comprehension checkpoints throughout the lecture this time, but I am going to ask that you bring all 4 of your answers to class with you on this paper that has your full name. So again, your comprehension checkpoint questions will be due at the start of class this coming Tuesday, and this time they're throughout the lecture instead of all at the end of the lecture. I like to switch it up a little bit, and this helps just for accountability and also just for fun. Okay, so here we go. Hopefully you have your paper and you're ready to go. So checkpoint number 1, an example of a muscular disorder that originates in the muscle itself is. Moving on to myasthenia gravis, and I think I've shared this with you in class, but my aunt actually has myasthenia gravis, and it's been a long process for her as far as figuring out how to manage it. So myasthenia gravis is progressive, and it is an autoimmune disease. Skeletal muscle fatigue and weakness are signs and symptoms of myasthenia gravis. So loss of acetylcholine receptors, it causes a breakdown in the communication between the nerves and the muscles. And so basically that makes it so anything that you do involuntarily can be affected. For example, she has had where her eyes are pretty much shut and she's unable to open or shut them. Also, the diaphragm is another thing, so breathing can be an issue here. Treatments include cholinesterase inhibitors, and this is such as neostigmine. This facilitates the acetylcholine accumulation and helps to strengthen the muscles. There is no cure for myasthenia gravis, but treatment can reduce symptoms, so it's more of a managing situation. Fibromyalgia is a disorder of chronic pain in the muscles and soft tissue surrounding the joints. Treatment includes physical therapy, antidepressants, anti-inflammatory medications, trigger point injections, and sometimes a narcotic analgesic. And it's hard to manage, and one of the things they've seen is they try to decrease the contributory factors. So for example, lack of exercise. So getting them to go to physical therapy or to start an exercise plan to strengthen their body. Okay, going back to your paper that you've already filled out, we're now on to number 2 on the comprehension checkpoint. The endocrine gland that is responsible for keeping calcium in the bones is... The endocrine gland that is responsible for keeping the calcium in the bones is... And that brings us right into abnormal calcium levels. Bone disorders include osteomalacia, known as rickets in children, in which calcium is lacking and cannot be stored in the bones, and it makes the bones brittle. And osteoporosis is a common bone disease caused by a lack of calcium, which creates holes in the bone. Both of these conditions are treated with calcium and vitamin D supplements. Estrogen may also be given to reduce the degree of osteoporosis. And here we see that explained. When calcium levels are low, it's not stored in the bones. It leads to soft, brittle, deformed bones, known as osteomalacia in adult and rickets in children. And then osteoporosis occurs with lack of calcium, which I said the holes are created into the bones, and it leads to like a spongy-like appearance, and bones break easily. That brings us to checkpoint number 3. So this will be number 3 on your paper. And the question is, which vitamin assists in the absorption of calcium? Too much calcium can lead to Paget's disease. This is cause for weak, fragile, and deformed bones. And the treatment includes calcitonin and bisphosphonates, which encourage strong bone formation. Vitamin D and calcium may also be required. Osteoarthritis is the erosion of bone where the bone meets at the joint. We mainly see this in middle age and elderly patients, and we can see it in patients that have been extremely sedentary or on the other end of the spectrum, extremely active. Rheumatoid arthritis is an autoimmune condition, and the joints are affected by inflammation caused by negative immune system reactions. Women 30 to 50 years old and children is where we most typically see rheumatoid arthritis. The treatments for arthritis include nonsteroidal anti-inflammatory medications, or NSAIDs, as we've learned in the past, which might include Advil, Motrin, or Aleve. Gout is a form of arthritis, and it's caused by buildup of uric acid in the joints. Uric acid is a natural byproduct of metabolism, and it's excreted by the kidneys. So some of the signs and symptoms: sudden severe attack of pain, redness, and joint tenderness. It primarily affects males, and We also have equal numbers of men and women after menopause. So before menopausal age of a woman, we see less, but after menopause, then we see equal numbers of men and women. Risk factors are excessive alcohol use, hypertension, diabetes, hyperlipidemia, and arterial sclerosis. Treatment is broken down from during the acute attack and then after acute attack has ended. So during the attack, it's NSAIDs in high doses to halt the attack and lower doses to prevent future attacks. For those unable to take NSAIDs, colchicine is utilized for the pain of gout and glucocorticoids for pain and inflammation. After acute attack ends, there's an anti-gout medication, and the name is Ziloprim or Uloric, and this is to lower the acid levels in the body. NSAIDs reduce inflammation, but long term they may increase GI bleeding and cause renal and cardiac damage. And aspirin and other analgesics are used topically and orally for pain to manage for the musculoskeletal system. That brings us to our comprehension check 4. All of the following are types of arthritis except. All of the following are types of arthritis except. Cyclooxygenase 2 or COX-2 inhibitors. They are technically considered NSAIDs, and they decrease the production of the prostaglandins that cause pain and inflammation. They may increase risk of heart problems, and the major contraindications are with sulfa drugs and sulfa drug allergies. Now we're talking about disease-modifying anti-rheumatic drugs. These are used in rheumatoid arthritis when other drugs are ineffective. It suppresses the autoimmune response, also suppresses immunity systemically, and may slow down joint destruction, although it is not a cure. An example of a DMARD is orothioglucose, and it's given by injection or orally. It works best in the early stages of the disease. DMARDs such as methotrexate and sulfasalazine are newer medications, and they are showing to be more effective DMARDs. Corticosteroids. Corticosteroids mimic cortisol produced by adrenal gland to reduce inflammation, and they're used short-term due to decreased ability to fight infection during the use. So they cannot be used as a long-term treatment. Phantom limb pain occurs after an amputation of a limb. The pain impulse originates in the brain and spinal cord, and it does not recognize that the limb is actually missing. So tricyclic antidepressants, anticonvulsants, and narcotics may help to diminish this type of pain for the patient. This actually concludes our lecture for today. I want to remind you that for your comprehension check, it was throughout, and there are 4 questions that you have now completed. Please bring them to class. You will be turning them in on Tuesday. I hope you have a great week, and I'll see you in class. Bye-bye.